Welcome to everyone joining us today. I'm Mohamed Younis, Gallup's Editor-in-Chief, and it's a pleasure to be your host for this discussion on promoting human flourishing with the renowned social scientist, Dr. Tyler VanderWeele. Many policy discussions and empirical studies in the social sciences focus on very narrow outcomes of well-being, such as income, a specific disease state, or measures of positive affect. But human well-being and flourishing stem from a vast range of states and outcomes. Today, we're going to delve into the concept of human flourishing and attempt to identify major determinants and also the sources for human flourishing through today's presentation by Dr. VanderWeele, after which we'll have a chance to cross-examine him with some of your questions, which you can type into the Q&A box that appears on your screen. Before we begin, I'd like to just start by mentioning that while this event is hosted by Gallup, it's really our amazing partnership with the Wellbeing for Planet Earth Foundation and our joint effort, the Global Wellbeing Initiative, that make this webinar and all we do possible. The Global Wellbeing Initiative's aim is to expand the concept and conceptualization and measurement of well-being with globally inclusive perspectives, while driving better understanding on how to promote well-being for all. Based in Japan, the foundation was established with the unique mission of contributing to the development of well-being by supporting researchers focused on well-being in Japan and across the world. In pursuit of this goal, Wellbeing for Planet Earth Foundation leverages the Gallup World Poll to create official global well-being metrics. Additionally, the foundation facilitates productive global discussions on well-being, exactly like the one we're having here today, as well as connecting academics and thought leaders across the world. On behalf of Gallup, I'd like to thank the Wellbeing for Planet Earth Foundation for their partnership in this important mission. It's never been more timely. Now, without further ado, let's get to the star of the hour. Dr. Tyler VanderWeele is a professor of epidemiology at Harvard University and director of the Human Flourishing Program. He's also a Global Wellbeing Initiative scholar. His research is focused on theories and methods for distinguishing between association and causation in the biomedical and social sciences, and more recently, psychosocial measurement theory. His empirical research spans psychiatric and social epidemiology, the science of happiness and flourishing, and the study of religion and health. It's truly an honor and a pleasure to welcome Dr. VanderWeele to the floor. Sir, welcome.
Thank you very much for the kind introduction, and welcome everyone to this presentation on the promotion of human flourishing. Today I'll speak a bit about what flourishing is, how we think about it. I'll make some remarks on attempts to assess or measure it. I'll talk about easy to do and employ activities for flourishing, and also the importance of communities in bringing about human flourishing. I'll make some final remarks with regard to the way I perceive important steps forward to promote human flourishing in practice. More information on the conceptualization I'll be presenting today can be found in this paper on the promotion of human flourishing in the Proceedings of the National Academy of Sciences, and some of the activities for flourishing can be found in this paper in the Journal of Positive Psychology and Wellbeing. More information on the Human Flourishing Program at Harvard is also available on the program's website. So what is flourishing? Well, if we turn to our various academic disciplines and institutions, we often find grand visions of human flourishing. The definition of health given by the World Health Organization in 1948, a definition still in place today, is that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The discipline of economics is sometimes described as an attempt to study how agents go about maximizing expected utility, supposedly taking into account all aspects of an agent's preferences. The discipline of positive psychology has been defined as the scientific study of the strengths that enable individuals and communities to thrive. But in actual practice, many of our studies and many of our discussions are focused on much narrower outcomes, like income or a specific disease state, or how happy we happen to feel at a particular moment. They miss this grand vision of flourishing. So what is flourishing? Well, if we turn to our dictionaries, we find in the Oxford English Dictionary, for example, that flourishing is defined as to grow or develop in a healthy or vigorous way. The American Heritage Dictionary defines it to do or fare well. The etymology of the term comes from Latin, florere, to bloom, blossom, flower. It's the word often used to translate Aristotle's eudaimonia, sometimes also translated as happiness. The working definition we've been using at the Human Flourishing Program at Harvard is that flourishing, or a state of complete human well-being, is living in a state in which all aspects of a person's life are good. And this is arguably what we're after as individuals and ought to be after as a society. I think the discipline that has come closest to trying to conceptualize and measure flourishing is that of positive psychology. And there have been numerous measures and conceptualizations of psychological well-being put forward in the positive psychology literature. But noticeably absent from these measures of psychological well-being are generally any notion of physical health. And are we really fully flourishing if we're bedridden, if we cannot move? Also absent from many of these measures and conceptualizations is any notion of character or virtue. Contrary to Plato or Aristotle, the majority of the Western philosophical tradition, and really philosophical, religious, cultural traditions worldwide. But with a notion so broad, so expansive, I mean, we might wonder if we can really make any progress on coming to consensus around what this flourishing is or how to go about measuring it. And certainly conceptualizations of flourishing are going to differ across individuals, across cultures and philosophical and religious traditions. So can we really make any progress? And what I would argue is that while it is the case that conceptualizations of flourishing will differ across religious and cultural and philosophical traditions, I think we can focus on what might be common to these various conceptualizations of flourishing. And what I would argue is that whatever else flourishing might consist of, it would at the very least consist of these 5 domains of human life as well. Not that flourishing is necessarily reducible to these 5 domains, but any reasonable conception of flourishing would also include these 5 domains. And these are first, happiness and life satisfaction. Second, physical and mental health. Third, meaning and purpose. Fourth, character and virtue. And fifth, close social relationships. Again, the argument's not that these 5 exhaust flourishing, but each of these domains are arguably part of it. I think also each of these 5 domains of human life satisfy the following criteria. Each is nearly universally desired, and we now have some empirical data to support this claim as well. And each is also an end in and of itself. It's sought for its own sake. It's not merely a means for some other end. And I think these 2 criteria, being an end and being nearly universally desired, might help shape consensus around what to measure. So, how have we at the Human Flourishing Program tried to go about the measurement or assessment of flourishing? Well, what we've done, a brief, admittedly somewhat crude index of flourishing. We've taken 2 questions, drawn principally from the existing questions that are widely used in practice and that have received at least some degree of empirical validation. The only questions that were really newly proposed were that in the character and virtue domain. And while very important and impressive progress has been made on the assessment of character over the past 2 decades, the book by Peterson and Seligman, for example, on character strengths was a very important step forward. While this important work has been done, there are very few questions trying to take more global assessments of character. Most of the existing questions are focused on very specific character strengths. And so we worked with philosophers to develop 2 questions based on the tradition of the cardinal virtues. That the foundation of all moral virtues lie 4: practical wisdom, or sometimes prudence, justice, fortitude or courage, and temperance or moderation. So what are our 10 questions? Well, they are as follows. In the first domain, happiness and life satisfaction, we ask, how satisfied are you with life as a whole these days? Scored 0 to 10. 0 completely unsatisfied, 10 completely satisfied. And this is perhaps the most widely used well-being question. It's used by the OECD. It's used in the UK's annual survey. It's been used by Gallup before. It's been used in a number of cohort studies. It will be used in next year's health interview survey here in the United States. But we supplement that then with a question more about how one feels, one's affective state. In general, how happy or unhappy do you usually feel? Again, 0 to 10. 0 extremely unhappy, 10 extremely happy. Second domain, physical and mental health. Once again, we've chosen questions widely used by the US General Social Survey, by the World Health Organization on self-reported physical and mental health. In general, how would you rate your physical health, 0 to 10? How would you rate your overall mental health, 0 to 10? Third domain, meaning and purpose. First question, overall, to what extent do you feel the things you do in your life are worthwhile, focused on activities? And this is, again, a very widely used well-being question, used, once again, by the OECD, by the UK's annual survey, and many cohort studies. But we supplement that with a more cognitive assessment as well. I understand my purpose in life. 0 completely disagree, 10 completely agree. Our fourth domain, character and virtue. Again, 2 questions. The first intended in some crude way to try to assess practical wisdom and justice. I always act to promote good in all circumstances, even in difficult and challenging situations. 0 completely untrue of me, 10 completely true of me. And then a second one trying in some very crude way to assess fortitude or courage and temperance or moderation. I'm always able to give up some happiness now for greater happiness later. And then our fifth domain, close social relationships. These 2 questions were taken from the UK's Campaign to End Loneliness survey of different measurement instruments based on their recommendations for short assessments. The first question, I am content with my friendships and relationships. 0 completely disagree, 10 completely agree, essentially trying to get at the quantity of those relationships. And then a second question, more focused on the quality of those relationships. My relationships are as satisfying as I would like them to be. So these are 10 questions to, in some simple way, try to assess flourishing across these domains. In much of our work, we look at these 5 domains considered separately because the dynamics are often quite different across these domains of human life. One can also aggregate them all into a simple index, average them 0 to 10 for an overall crude assessment, but really this should be interpreted as nothing more than an average of those 5 more meaningful scores. In addition to these 10 questions, we typically supplement them with 2 others, trying to assess financial and material stability, because these are important means to try to sustain the other ends of flourishing over time. And so the 2 questions we use in this financial and material stability domain are, how often do you worry about being able to meet normal monthly living expenses? And this is, again, one of the most widely used questions in the financial well-being literature. And then secondly, how often do you worry about safety, food, or housing? And we sometimes will aggregate all 12 questions for more of a index of secure flourishing over time. It's perhaps somewhat less satisfactory conceptually because financial resources are means rather than ends, but arguably more adequate in practice as indicating flourishing over time. So as an example with regard to how these measures can be used in practice, we've collected data both before the WHO declaration of the COVID-19 pandemic in January of 2020, and again in the midst of the pandemic in June 2020. This is roughly nationally representative data from the United States. And in January of 2020, essentially before the pandemic conditions started adversely affecting well-being, what we see is that the average in the United States across most of these domains is about 7 out of 10. A little bit of variation around 7, but not that much. The one exception is the financial and material stability domain, where the mean was just below 6. As a consequence of the pandemic, unsurprisingly, well-being has fallen. Overall, it's gone down by about 0.5 point. But interestingly, the different domains have been affected in rather different ways. We turn to happiness and life satisfaction. Again, perhaps unsurprisingly, that's gone down by nearly 1 point due to the pandemic. Likewise, mental and physical health, perhaps unsurprisingly, has gone down by almost 1 point as well. With financial and material stability, we find the largest decline. Again, unsurprisingly, given especially in June of 2020, that was the peak of unemployment in the United States, and employment insecurity has continued. So well-being has fallen, and has fallen substantially in these domains. But if we look at some of the other domains, the declines are not as large. In meaning and purpose, we do find some decline, but not as substantial. Our character assessments have been pretty much level. And rather surprisingly, the close social relationships domain has gone down a little bit, but not much at all, in fact. It seems that people have found ways to invest in their existing relationships, in family, in connecting with friends, perhaps in using various virtual means. So we had anticipated much larger declines, and there has been some, but not as substantial as one might think. However, these means disguise variability in experience, and the variability, the standard deviation, the variation in responses have actually gone up in all of these domains as a result of the pandemic. So while for some, this time has perhaps been one to invest deeply in family, there's evidence, for example, that children feel closer to their fathers than before the pandemic. For others, this has probably been a very difficult time socially. Those who are living alone perhaps have struggled substantially. And so it's important not just to look at the means, but also the variability and the distribution. But this can give some sense as to how these even fairly crude flourishing measures can give tremendous insight into how our country and our world may be doing. So we've been making various data collection efforts to better understand and study flourishing in different contexts. We've collected data in a number of workplace settings with employees at Aetna, Kohler, Owens Corning, and the World Bank, factory workers in Mexico, Poland, Sri Lanka, Cambodia, China, a group of international flight attendants, and in a number of other settings as well. We've been looking at the role of flourishing in healthcare with mental health patients at Boston University. Begun discussions with University of Pittsburgh Medical Center. We've collected data in a number of educational contexts at Yale, at Medical College of Georgia, Stony Brook Medical School, in a number of secondary schools in the United States, the UK, India, and China, in various communities in Columbus, Ohio, in partnership with the Columbus Foundation. We've embedded these measures in a randomized trial of a forgiveness workbook intervention that we're testing, which I'll make some remarks on later. And in collaboration with Gallup Templeton Foundation and Baylor, we're trying to launch a global flourishing study to better understand the distribution and determinants of flourishing throughout the world. Some of the patterns that we've observed in this cross-cultural work thus far are that the financial and material stability domain is often rated the lowest. Not in all contexts. In some of our employee samples, that's not the case, but in many. We also see that the social connection domain is considerably lower in the United States than many other countries. And we've found evidence that many of these domains, the well-being scores, in fact, increase with age. And this is somewhat in contrast to some earlier work that had suggested more of a U-shaped patterns with age, where the young and the old were doing reasonably well, and those middle-aged, those in the 40s and 50s specifically, tended to have the lowest well-being scores. And this more recent evidence has suggested that that left part of the U may be flattening, that young people may not be doing as well now as they had been previously. I think it's also important to appreciate and understand and ponder how we can address these issues. So we are trying to launch this global flourishing study. We should have a definitive confirmation that this is going to go forward by June of this year, but this would be a study of 300,000 individuals in 22 countries with nationally representative sampling within each country, representing 2/3 of the world's population. And we'd follow this group of 300,000 individuals once a year for 5 or 10 years to gain a better understanding of the distribution and the determinants of flourishing so that we can also better understand how to promote it. So I now want to transition to these questions of how do we promote human flourishing? It's good to understand and assess and determine how these patterns are changing over time, but ultimately we want to improve well-being also. So how might we do so? I think a good place to begin is the positive psychology literature that has been reflecting upon these questions for some time and have developed easy-to-use, do-it-yourself interventions. Some of these, many of these, in fact, have been tested in randomized trials and found to positively affect various aspects of well-being. Some examples of these, perhaps the best studied one, is gratitude interventions, where, for example, 3 times a week, you'd write down 3 things you're grateful for and why. You do this for 6 weeks. And as shown in randomized trials, the same sorts of designs we're using to test vaccines, so the most rigorous sorts of designs and evidence have indicated that these gratitude interventions increase happiness, alleviate depressive symptoms, improve quality of sleep, reduce self-reported health symptoms. And these have now been studied in dozens of randomized trials. The evidence here is very strong. As another example, acts of kindness interventions have been proposed, where, once again, maybe for 6 weeks, you commit to each week finding one day where you do 5 acts of kindness that you wouldn't otherwise do. I try to do this once a year myself and find it very helpful. You actually have to plan in advance if you're going to do all 5 on a single day rather than spread out over the course of a week. But again, studies have found that these acts of kindness interventions improve happiness and improve kind of engagement with life and various other well-being outcomes. Another sort of example is to identify one's top character strengths. The Penn Positive Psychology site has a values in action assessment where you can identify your top 5 character strengths out of a list of 24. And then these activities consist of trying to use each of those in a new way once a week. And these likewise have been found in randomized trials to improve happiness and alleviate depressive symptoms, even 6 months later. So good evidence that these various easy-to-use, do-it-yourself positive psychology interventions are effective. There are a number of other resources to try to deal with issues of psychological distress. Some of these are in workbook form. David Byrne's Feeling Good book for depression has been evaluated in at least 5 randomized trials and is found to alleviate depressive symptoms to some degree. This is not a replacement for a therapist or proper psychiatric care, but for those with more mild depressive symptoms, it can be a very valuable resource. Likewise, Barlow and Kresge's book, Mastery of Your Anxiety and Panic. There's, I'd say, less definitive evidence, but this has been examined in at least one randomized trial and found to have had similar effects on anxiety to other sorts of interventions. Right now, we're evaluating a forgiveness workbook intervention for those who have been wronged and want to forgive and are struggling to do so. But drawing upon 30 years of work in clinical psychology, Everett Worthington has developed a forgiveness workbook, and we're working with him to test this in a randomized trial in 5 different countries, in Colombia, South Africa, Ukraine, Hong Kong, and Indonesia. And we're going to evaluate, based on some earlier, smaller preliminary data, whether this has effects not just on promoting forgiveness, but also reducing depression, reducing anxiety, increasing hope. So these are a variety of different resources that one can use as an individual to try to promote various aspects of well-being. And I think if these resources were disseminated broadly, it would have a substantial effect on population flourishing. The effect sizes are not huge, they're modest, but they've been well established scientifically. And so if we were to make use of them at the national or global level, I do think it would make notable differences to well-being. So these are just a few examples. More of these activities can be found in a recent review I wrote, Activities for Flourishing, an Evidence-Based Guide, published by the Journal of Positive Psychology and Wellbeing. The Human Flourishing Program has also produced a brief flourishing app, which implements many of these activities as well, which is downloadable for free from our website. So many of these activities that have been developed in the psychology and positive psychology literature, there's strong evidence for effects on happiness and on health. But the effects are less clear on the other domains of flourishing, on purpose and meaning, on character, on relationships. And the interventions that have been developed to try to improve purpose in life, for example, in the positive psychology literature, have generally failed. These other domains of life, in fact, seem more difficult to alter just by simple, easy-to-do one-off activities. I think to alter these other aspects of well-being, we in fact need participation in communities. We need institutions. We need longer-term relationships. We need investment. We need other people helping to shape our lives. And so I think in pondering this question about how else to promote flourishing, it's important to try to identify those factors that are common in the population and that have large effects on flourishing. And this is often the lens we use in my own discipline of public health. We assess the public health impact of an exposure or an activity or phenomena based on two factors: its prevalence, or how common it is, and the effects, the size of the effects on the outcomes we care about. Something that's common and has large effects is going to powerfully shape population health. So if we use this lens to think about physical health, we identify factors like exercise and nutrition and not smoking and sleep. But we could also use a similar lens to think not just about physical health, but flourishing more broadly. We can ask, what pathways are there that are both common in the population and have large effects, not just on physical health, but across the flourishing domains, on happiness, on health, on meaning, on character, on relationships? And so based on a review of the most rigorous studies, I would propose four communities for flourishing. And these are, and again, evidence from rigorous study designs: family, work, education, and religious community. There's evidence that each of these is relatively common in the population, both in the United States and worldwide, and that each has substantial effects on the various flourishing domains. The argument here is not that these four are in any way exhaustive. There can be other forms of community participation or other activities that powerfully promote flourishing in an individual's life. Participation in the arts, for example, might be very important to some individuals, but perhaps less common at the population level. The argument's also not that these four are necessary. One can flourish even in the absence of one or more of these pathways. The argument, rather, is that there's evidence that each of these powerfully affects the flourishing domains and is common in the population. And that if policy efforts contributed to enhancing these various flourishing communities, these pathways to flourishing, that population well-being would increase. So in this literature review, I'm going to put on my hat as a statistician just for a moment, for one slide. In this literature review, we restricted attention to the most rigorous sorts of study designs: longitudinal designs collecting data on individuals at multiple points over time, experimental and quasi-experimental designs that try to introduce random variation, and importantly, cross-sectional designs where all the data was collected at once were excluded. And that's because it's very difficult to work out the direction of causation with cross-sectional data. As an example, there's evidence that marriage is associated with greater levels of happiness. But with cross-sectional data, we don't know if that's because marriage actually increases happiness, or is it because happy people are more likely to go on to get married? With cross-sectional data, we can't tell. There is evidence for both, but cross-sectional data doesn't help us sort that out. Likewise, there's evidence that religious service attendance is associated with lower depression. But with cross-sectional data, we don't know whether that's because religious service attendance reduces depression, or is it because depressed people are more likely to withdraw from their religious communities and from other forms of communal participation. Again, there's evidence for both, but we can't tell from cross-sectional data. We need these longitudinal designs. So we want these longitudinal designs with control for the baseline outcome we care about. Ideally, we want to aggregate evidence over multiple studies. And so that was the goal of this literature review. And a brief summary of that literature review can be found in this diagram here, where we have the 4 pathways on the left, the 5 flourishing domains on the right, and these little numbers are references to papers that have and utilize these more rigorous designs, providing evidence for these effects. In some cases, the evidence is quite strong. We have many good studies. In other cases, the evidence probably needs strengthening. There's perhaps just 1 or 2. So there is more research work to be done. So we've discussed briefly about individual activities that can be used to enhance flourishing and important communal pathways for flourishing. I want to take a step back then and in our last 5 or 10 minutes reflect upon the implications of this work. I had noted earlier that with regard to the individual activities, I think these resources should be broadly disseminated. I think we should do so at the national and global level, in schools and workplaces and medical contexts. Wherever we can, we should talk to people about these resources of gratitude and acts of kindness and forgiveness. I think doing so would increase well-being at the population level, and I think would lead to a greater orientation, pro-social orientation towards others. Things like acts of kindness and forgiveness help build relationships of trust. So it increases, I think, both individual well-being, but builds better communities so that we can also make better use of the communal pathways towards flourishing. I think there's also a role not just for individuals and institutions, but for governments to promote flourishing at the societal level. I think this work on identifying the communal pathways to flourishing has important policy implications. I think, for example, in the work domain, welfare policy shouldn't disincentivize work. It is important to make provisions for those who are worst off, but policies that simply provide income and health care and don't provide a pathway into work only address a couple of the flourishing domains. They address financial stability, they address health, and those are really important. But the powerful contribution of work to giving a person a sense of meaning and purpose, to providing a forum for relationships, to being able to make use of one's strengths are absent. So we really need to help those who are worst off find meaningful work, meaningful activities. And there are very impressive supportive employment programs that have been designed for the mentally ill and for those who are disadvantaged, which have been tested in randomized trials and have found to increase these employment opportunities. So I think we need to make use of that and structure welfare policy accordingly. Now, with regard to the marriage domain here in the United States, I think we should get rid of what are sometimes called marriage penalties in the welfare system, where 2 people who are together, if they become married, actually lose some of their welfare benefits, disincentivizing marriage even for those who might want to marry. And so I think that should be eliminated. Likewise, I think some of the more recent resources on online marital counseling could be more widely disseminated to try to deal with marital problems before things get so bad that divorce seems like the only option. A lot of the early work on marital counseling was not very evidence-based, but the work has gotten better and better. There's still resistance because people are embarrassed to go and often it's expensive, but these online programs have been tested, at least in some preliminary randomized trials, and have been found to be effective and are much more cost-effective. Again, I think these could be widely disseminated. In the education domain, I think it really is important to give all students access to good teachers. And arguably especially the most disadvantaged students and often the poorest teachers end up in the poorest communities. That needs to change. We need to structure our education system to give all students access to good teaching. And I would argue also to give parents choice as to what sorts of schools they want to send their children to. We've begun some early empirical work looking at not just the effects of school choice on educational outcomes, which of course is essential, but on a whole range of flourishing outcomes. And so I think giving parents choice is also a good idea. With regard to religious communities, I think it's important to continue to promote religious liberty, to retain tax-exempt status, to allow these communities to carry on their good work. And I think it's also important to correct some of the unbalanced media and academic portrayals of religious communities. Certainly there have been problems in religious communities, I think, and these need to be addressed. I think the sexual abuse scandals that have taken place are terrible, and really work needs to be done for better prevention, better healing. We're in fact organizing a symposium next month to try to reflect upon these issues of prevention and healing within religious communities at the Human Flourishing Program. So there have been problems, there have been issues, but almost all of the media attention is focused on the problems that need to be addressed. I think there needs to be a more balanced portrayal of the important work these communities do in promoting meaning and purpose, in promoting relationships, in providing food and care for those who are in need. So we need both criticism and critique, but we also need to highlight the important work these communities do, both in the media and in the academic world as well. So I think these sorts of efforts at the national level would better help these various communal pathways to flourishing, to enhance societal well-being. So I'd like to make a few concluding remarks with regard to what I think the future of this work might be. I think we need to broaden our lens of thinking about well-being to concern all aspects of human life, all aspects of flourishing. This is, again, what we are each after as individuals, and I think more of that sense of the holistic care of the person needs to find its way into research and into policy efforts. I think in our academic studies, we need to focus not just on one or two narrow outcomes, but look at the whole range of flourishing outcomes. Try to identify those interventions, those activities, those exposures, those communities which enhance not just health or not just income, but also meaning and purpose, that increase trust, that build relationships. I think doing so in a research context will help us better understand the determinants of well-being. I think likewise we need better support for broader well-being research. We invest heavily and importantly in how to improve physical health, how to improve income for those who are disadvantaged and at a national level, and that work's important. But only a tiny fraction of resources is devoted to other well-being domains like happiness or meaning or character or relationships. I think we need greater investment by the government and by universities in decisions on hiring and promotion with regard to these other well-being outcomes as well. I think governments and organizations really should start tracking flourishing at national and global levels. GDP has been the dominant measure of societal progress for too long, and it is an important measure. I would never want to discard it, but we need to supplement that with other well-being measures. Likewise, I think employers and medical centers and universities schools should start tracking flourishing over time to see if things are getting better or worse, to identify those domains of flourishing which are not as good in their particular community, and then to make efforts to improve it. I think these flourishing assessments are important because what we measure shapes what we discuss, what we study, what we know, what we aim for, and the policies put in place to achieve it. So I think we need to do a better job of assessing flourishing in all these different contexts. I think we should be aiming for flourishing both personally and at the societal level, as communities, as nations, and as the entirety of our world. Thank you very much, and I'm happy to take any questions.
Dr. VanderWeele, wow, what an awesome presentation. Thank you for sharing your brilliance. I've had the honor of learning from you previously, and this was just absolutely awesome as well. I want to thank everybody for their very sharp interest in both the slides and whether this is going to be available after. Two things you know when most of the questions are, can we get the slides and will this be available, is the host did a horrible job of mentioning that at the beginning, and the presentation was amazing. So for everybody listening, you will be able to watch this presentation in replay about an hour after this event is over. While you won't have the PowerPoint slides, you'll be able to see the slides as they were projected through the presentation. I'm going to encourage you all to continue to send in your questions. I'm going to start by asking a couple of my own. Let me start with this one. Dr. VanderWeele, most of this work around flourishing is done within the field of psychology. How did you fall into this kind of work, given the fact that your background is actually in public health? And how does this sort of work fit into public health? And how does that go align with other fields of research? Talk to us about the interdisciplinary nature, really, of understanding flourishing.
That's a very good question, because I certainly think positive psychology has been dominant in this space and has made really important contributions. And I think other disciplines need to come alongside. My own work on this began when I was studying the role of religious communities in shaping physical and mental health outcomes. And I found large effects from the most rigorous data, and that led me to start thinking about, well, what else might shape population health that we're neglecting? And so that brought me to studies on parenting practices and on forgiveness. Then I started thinking about, well, people care about physical health, but they care about more than that as well. They care about being happy and having a sense of meaning in their relationships and trying to be a good person. Why aren't we studying these other topics with the same level of empirical rigor as we are physical health? Why do we know so much more about the determinants of cardiovascular disease than we do about the determinants of a sense of meaning and purpose in life, despite that being desired by almost everyone? And I'm all for the rigorous study of cardiovascular disease, but I think we should be applying the same sort of rigor to these other important well-being outcomes. And I think each of the disciplines has something to contribute. Again, I have very much appreciated the contributions that have come out of the positive psychology literature. But we need other disciplines as well. We need public health. We need sociology. We need economics to also think about these questions. Psychologists come to this with a particular lens, often individual psychology, and perhaps miss out the important contributions that communities play. Likewise, I think it's important that public health and medicine and epidemiology engage with these questions because of the extraordinary infrastructure that exists to promote health, and I think ideally also well-being. So I think we do need all of these disciplines working together on the promotion of human flourishing. I think we need to see in these other disciplines the same sort of movement that happened within positive psychology. In that regard, just last year I published a short piece entitled Positive Epidemiology, ? Arguing that in my discipline, epidemiology, we need to see similar movement towards other positive outcomes, not just disease states, and towards positive health assets, not just risk factors. I think if this were to happen in epidemiology, and also sociology and economics, and other disciplines, we'd be better able to study and promote well-being.
And I'm so immediately reminded by Don Clifton, the founder of the Strengths and Strength Psychology, and his very famous quote when he said, so much is committed to studying what's wrong with the world. What if we studied what's right with what's happening around us? And it gets right to the heart of what you're mentioning. My other question really gets also to the heart of why I love what this partnership is all about. Talk to us about how Western-centric the concept of human flourishing has been in the ivory tower in academia, and how can we develop a more globally inclusive concept of flourishing or well-being?
I think that's a very, very good, very important question as we continue to ponder how to promote well-being at the global level. And I think unquestionably the well-being research and literature and thinking has been shaped by Western perspectives. That's where most of the, at least academic work, has been done. So it's understandable that that's taken place. And I think it is important to broaden that perspective. And I think the work of the Global Wellbeing Initiative, this joint venture between Gallup and the Wellbeing for Planet Earth Foundation, is critical. And it really is an honor to be able to participate in that. And so I think we will see with time an expansion of our understanding of well-being. I would still argue that these 5 domains of human life are shared pretty much globally: happiness, health, meaning, character, relationships. And I think there's evidence for that. But I think the big question is, what are we missing with those 5? And I think some of the early work of the Global Wellbeing Initiative has suggested that concepts like balance or harmony or peace are a much more substantial component of the understanding of well-being in non-Western societies, and that we've perhaps neglected these. Not that they're unimportant in the West. People would like them as well, but they just don't play as prominent a role. And so we've neglected them in our study and in our thinking about policies to promote them. And so I think as the global study of well-being continues, it will be important to identify those aspects of well-being. I think another area which has been neglected by most of the Western perspectives on well-being is that of spiritual well-being. And for much of the world's populations, some notion of religion and spirituality is important, often the most important aspect of well-being. And I think this has also been neglected. I think to do good work in this area, one needs to develop more tradition-specific measures. That understanding of spiritual well-being is going to differ in Christianity versus Islam versus Buddhism or Hinduism or Judaism. And so I think we need to move towards tradition-specific measures. And we've started some of that work at the Human Flourishing Program at Harvard, but have a long way to go. But my position would be that we should supplement that where there is universal consensus with that which is particular or tradition-specific. And I think doing so would help us also better study at the global level what it is that people most care about.
Okay, here is our first question, our cross-examination here from our global audience. Thank you all for sending them in. How does love contribute to an individual's perception and or lived experience of flourishing? The concept of love is being used in my organization by leadership, and I'm curious about if or how love is or is not included in your research. What did you learn about love?
Well, in fact, we have just launched a effort to better assess and study both the contributions of love to well-being, but also what gives rise to love within communities and in different types of relationships. My view, although this work is at a very early stage, is that this is perhaps one of the most neglected aspects and contributors to well-being at the global level. I think we tend to shy away from using that word in academic work and prefer to use something more like prosociality. But I think it misses something that's really fundamental to the human experience. I think love understood sort of a disposition either to be with the other or to contribute to the life of the other is fundamental to well-being. I think the contributions as social creatures, social animals that we make to one another in relationship is critical. I think it enhances happiness. I think it promotes health. I think it self-constitutes character and is, of course, an essential part of relationships. It moreover, is often where we find meaning. So I think the study of love and well-being will be really important in the decades ahead. And I think it's some of what we're missing in, at least in the United States, in the country in which I live. The political tensions and divisions, not just at the organizational level, but between individuals, I think is problematic. I think we need to always be looking out for the well-being of the other, even those with whom we disagree. I think within my own tradition, Christianity, the teaching of love of not just neighbor, but love of enemy is really critical. And so I think the sorts of activities like acts of kindness and forgiveness are important tools to promote not just well-being, but to increase love. So this work is at very early stages. I think many of our measures of love at present are not particularly good, which makes the research difficult and makes it perhaps seem less important than it really is. But my hope in the years ahead is that we can establish love as a critical factor in improving well-being and learn better how to promote it. And again, I think this is something where there can be consensus at a global level as well. That notion of love of neighbor appears in Jewish and Muslim and Christian traditions. I think trying to develop that love for the other, that care for the other, that recognition of the inherent dignity of the other and someone who is good to be with and good to contribute to the lives of, I think is critical. So I do very much hope that work in this area continues to move forward.
I know that a lot of your work is focused on sort of the intersection between human flourishing and religion, or more traditional religious identity. Talk to us about what you've learned about the flourishing dynamic and concept with those that aren't particularly religious or don't particularly identify with one religious community, but obviously are still experiencing, if you will, spiritual wellness in their own way.
Yeah, so it's a very good question. And I mean, I think there are two important factors there. One is kind of participation in non-religious communities, which I think are also extremely valuable and important, and then kind of other aspects of spirituality outside of religion. The existing research has suggested that, at least for the general population, if you look at different forms of religion and spirituality, it's really often the communal ones that most powerfully affect health and well-being outcomes. I think private practices are often important in a person's spiritual life and otherwise, but don't seem to have the same sorts of effects on these health and well-being outcomes as does that communal form of participation. Dynamics are a little bit different at the end of life. There, the role of personal spirituality and spiritual coping and prayer comes to life in a much more prominent way. But what the existing empirical research has found is that it's really the communal forms of spiritual or religious practice that most powerfully shape health. But I mean, likewise, there is evidence that non-religious communities also powerfully affect health and well-being. The effect sizes generally aren't as large, but still meaningful and important. And I think an important direction of future research is to understand how different forms of community life affect different health and well-being outcomes. One study suggested, for example, that participation in arts and education communities, along with religious communities, most powerfully shaped levels of happiness and life satisfaction. But how does that relate to physical health or to meaning or to relationships? I think more work needs to be done. My speculation is those communities that most closely resemble religious communities insofar as kind of having a shared sense of purpose, a shared set of values, a history of the organization that extends beyond the life of the individual will perhaps more powerfully affect health and well-being. So that, say, a volunteering or maybe a political organization might have stronger effects on health and well-being than, say, showing up to a weekly card game. I think even the weekly card game is valuable and important in building relationships and bringing about happiness. I just think that the effects are going to be a bit smaller. So again, I think other non-religious forms of community life are important as well, and we need to learn more. And again, I think other forms of spiritual practice, I think perhaps especially meditation and mindfulness, make a contribution. But I would say the existing evidence suggests that it's communities that are really essential for promoting well-being, not just across one domain, but flourishing more broadly conceived.
Speaking of communities, most of us, a lot of us spend, when we're not in a pandemic, most of our time at work. As people begin to return to their work environments following the COVID-19 pandemic, What practical steps, Doctor, would you suggest an organization and its leaders take to encourage human flourishing in the workplace? How can we bring this concept into a now battered and bruised kind of workplace post-pandemic?
I do think the workplace is, in fact, really very much a neglected pathway towards well-being. We spend a lot of our time at work, and I think consequently there are potentially a lot of opportunities to promote well-being at work. Again, I think flourishing assessments in the workplace can be helpful to identify what aspects of well-being employees are most struggling with, and then to reflect on how what efforts might improve those. I think also workplaces can be structured intentionally to promote well-being. I think creating opportunities for community involvement, for maybe volunteering, for example, can be really helpful and valuable. I think likewise, finding activities that allow individuals to make use of their strengths, the evidence suggests can also be helpful as well. I think emphasizing the mission of the company or organization and making clear how someone's work actually contributes to the final ends of what the company is trying to do is also a really helpful way to enhance meaning and purpose within the workplace setting. So I think there are a number of things that managers can do, but I think there are things individual employees can do as well. A couple of decades ago, the crafting was introduced to the workplace literature. And this is really a bottom-up approach, something that doesn't require permission from a manager. But the idea is to reflect upon your work and think about three things, essentially. Think about your activities and whether you could structure them in a way to be more efficient or to enjoy them more. Think about the relationships at work and what you might be able to do to invest in those and to improve in those. And then, once again, think about the purpose of the organization you're working for. And how your contribution, while the day-to-day tasks might not seem related to anything grand, if it is contributing to the organization's functioning, it is helping accomplish the organization or the company's mission. And that can really enhance one's sense of meaning and purpose. We've recently done a literature review on all the rigorous job crafting studies, and with, I think, pretty strong evidence that these sorts of job crafting activities that can be done by a janitor or by a manager or a clerk or someone doing data analysis can be done by anyone, really does enhance job engagement and can enhance well-being. So I think there are things that can be done both at the managerial level and at the individual level to make the workplace one of these communities for flourishing.
Dr. Tyler VanderWeele, what an amazing presentation. We want to thank you for your time and your effort. We also want to thank this awesome partnership we have with the Wellbeing for Planet Earth Foundation. I would encourage you, if you're interested, to also listen into our podcast, A World of Wellbeing, which is brought to you by the Foundation on all podcast platforms. Dr. Tyler VanderWeele is one voice that you'll hear there, as well as many others. Thank you for joining us today, and as always, we wish you to be well.
And thank you all. It was really a